good evening. Welcome to the Coronavirus Update Show. My name is Omari, Salisbury. Got a great surprise in store for all of our normal viewers of the Coronavirus Update Show. Today, I'm actually joined in studio by producer Nikki, Barron.
Hi, I'm here.
Look at you. You made it out here, huh?
I did. I made it into the studio. It's been a little bit since we've maybe done one show like this?
Yeah, maybe just one where you've actually been in the studio. I can tell you it's a pleasure to have you here. Welcome back.
Thank you.
I'm sure that this appearance that you have here will be short-lived.
Yeah. I mean, especially after the information I'll give you today.
Looks like we got more bad stuff coming people's way. All right, as usual, Nikki Barron, we start with the numbers. Why don't you get into it?
Yeah, here we go. So total cases have reached 335,693, which is up 882 since yesterday across Washington state, with a total of 19,160 hospitalizations, as well as 4,881 total deaths, which are up 31 since the last time they reported the deaths. And we've given out 1,379,318 vaccines so far. And as of February 11th, we've seen a 40% decrease in case rates with a hospital case rate or hospital capacity rate of 81%. And our positivity rate statewide is 7%. So these numbers will be updated again on February 25th. Because now they do these ones on like a rolling 2-week schedule, and it's how we decide what phases that we're in.
Right. And I talked to Lily Fowler, who is a journalist over at crosscut.com, and what Lily talked about was how much the vaccines distribution or vaccination was disrupted due to the weather.
Yeah, we're seeing that nationwide. I think we only got like 30% of the vaccines in our last shipment that we originally were going to get because of the snow.
Well, hopefully get it back on track.
Yeah, hopefully. It looks like it's clearing up. I'm not seeing a lot of big snow warnings in the nation right now, which is great because I think for that 1-week period, it was like everywhere in the United States had a severe weather warning.
Right. All right, what else you got for us?
So I am talking about the big news, which is the new South African variant. So also known as the B.1.351 is officially in King County. They have one case. And that's really alarming because it's really viral. It's more viral than the UK variant and its virus, and it's more viral than the one that we've been dealing with. And that's what makes that so dangerous. But we also saw that it's about 6 times less receptive to the current vaccines. And so usually if there's one case in the community, you can expect that there's, remember in our first episode, actually we learned about this, there's probably 10 out there that we don't actually know about.
So what are you saying? we can expect this B.1.351
yes,
to be on the move throughout the county, possibly?
Yeah, and it's really alarming because the case was discovered that this person was positive on January 29th. They didn't get the information until just a few days ago, and they've yet to be able to contact this person to figure out where they were when they got it. Was it through travel? Was it through community spread? And how many people they've been exposed to since they have it. So they still haven't been able to contact trace this person who has it.
And the variants, just to remind our viewers, the worry is about these variants is not so much that or maybe it is as well, that the vaccine isn't effective against it, but the bigger worry is that it's way more contagious.
Right. So even with it being about 6 times less receptive to the vaccine, you're still going to not be hospitalized from COVID. There's no likelihood of death as long as you're vaccinated. But it does increase the ability for it to reinfect somebody who may have had a different strain of COVID. So you could get COVID again and get a more severe case from this variant.
Yeah. You ever have any good news on this show?
We're going to end with a little bit of good news. I've been trying to take Reverend Harriet's advice and make sure I add like at least one good story. So we will get a good story at the end. But unfortunately, this is not the case. So King County Public Health, Dr. Jeff Duchin, he emphasized the things that he's been emphasizing. Wash your hands. If you can double mask. And continue to do physical distancing, even though our numbers are going down. The fact that we have the UK variant, which doubles every 10 days the amount of cases that they find with that, and now this one, it's kind of like the tip of the iceberg, is what he's predicting. So keep up the hard work, King County, and stay home if you can, and double mask if you can't, and wash those hands.
Man. All right, we're going to take a quick break. When we come back, we're going to talk about a new mapping tool, right? The University of Washington.
Yeah.
Cool. You're watching the Coronavirus Update Show. All right, welcome back to the Coronavirus Update Show. My name is Omari, Salisbury, joined by producer Nikki, Barron. And Nikki, you're always finding this cool and interesting tools on the internet. Looks like the University of Washington has one out now.
Yes, so the Omari's going to pull it up so you guys can actually see it because it's an interactive tool. Here we go. So the city of Seattle now has a new tool courtesy of the University of Washington to help us actually improve equitable vaccine distribution. So the Social Vulnerability Index and COVID Story Map allows the city to compare by zip code and census tract a community's COVID-19 positivity rate, and it kind of intersects it with other potential vulnerability factors such as like minority levels, poverty levels, household size, and even transportation access. And you can see here the darker areas are the areas that have the higher amounts of potential vulnerability factors, those minority levels, poverty levels.
Hold on, man. Looking at this map, the only area that's not shaded is like the western part of West Seattle, Alki, and then Queen Anne, Magnolia, of course, Santa Bay.
I mean, that's not any information we don't already know, though. You know what I mean? So
it is hella shaded in the south end. South end is this darkness.
Yeah. So using this tool and being able to, I think there's more data here. We all know kind of what are the areas that have vulnerable communities, but here it is based on the data of where these pop-ups should be. The city has plans to host more pop-up clinics in the areas that you see, these dark shaded areas, hardest hit by COVID. And I'm really interested to hear how they are not just having these pop-up vaccine events and then just having people from these not shaded areas take all those appointments.
Right. Well, I know that, let me bring this back out here. I know that in the pop-up that was at First AME that Jay Gravenbrodt actually covered for us there. What the city did, the Seattle Fire Department, is that they partnered with the Central Area Senior Center and several Black churches, First AME, Tabernacle, I believe Mount Calvary. And those were the people who actually provided the participants to get vaccinated. And also it wasn't known to the public until afterwards. So I know that at least at First AME, the one they did at First AME, they were very intentional about working closely with community partners to basically avoid what you just said, people from other parts maybe of the city coming and taking those slots.
Yeah, I was listening to a story on NPR in San Francisco where they were actually talking about this, that's a huge area a huge problem that they have right now is that these hospital systems and doctors, they'll get all their appointments and they'll be like, wow, these appointments are with people that don't look anything like they should for this neighborhood and for whatever, phase that we're in for vaccinations. And so a lot of doctors are actually calling and doing manual appointment setting with their patients that they know fall into these categories to try to get them vaccinated, because the more tech savvy, wealthier people of San Francisco were actually taking other people's appointments, and driving to these areas that those appointments aren't for you.
Vaccine game is cold, man.
It is so cold. There's entire Facebook groups now where volunteers help people who are not great with tech and are not good at, maneuvering these systems, whether it's language barriers or things like that. And they're actually like going and helping helping people get their vaccination appointments, because people are gaming the system. I mean, there was a story out of Florida of somebody who actually, 2 women who dressed up as elderly women so that they wouldn't be like looked at weird when they showed up for their vaccine appointments that they lied to get. So it's definitely a thing. And I'm glad to hear that the state of Seattle is trying to combat that, because it's so important.
They've been real intentional. So, the city only gets 1,000 vaccines per week. So they've been real intentional. I mean, and when they did the frontline grocery workers, they partnered with the UFCW, who also in turn provided the people who were getting vaccinated. So, I mean, with only 1,000 vaccines per week or something like that coming into the city, they've definitely been very deliberate.
Yeah, I'd love to see this tool get used by the county and the state to also go door to door with vaccines, target buildings that are, things like the NAM building, where the tenants are predominantly Black, things like, going to those areas and trying to go door to door and give the vaccines that way, and not just doing pop-ups, but, hitting the streets with it, because I think that's the only way we're ever going to get over this racial disparity when it comes to vaccines. And the city can't do it with 1,000 vaccines a day.
No, they definitely can't. There's another tool that you have for us, right? I need to fish it out here. And while I do, maybe you can explain it to everybody.
Yeah, so the New York Times created an interactive tool using modeling. And so they looked at a few different scenarios, and in these scenarios, they kind of give you 3 options that you can look at. So the first scenario that we have is about vaccinations. So if we continue vaccinating at our current pace, we're going to see, which is about 1.7 million shots per day, we could reach herd immunity by July, which is, it feels like not that long now at this point, because this has been going on for so long. My sense of time is very warped. But in that time, and at that pace, we're still expected to lose another 100,000 lives from the virus if we continue at the pace that we're at. Now, if you move on to that one where it says, if we're able to increase the supply, we could, if we got it all the way up to the 5 million shots per day, we could reach herd immunity by April. Yeah, and that last one there. Sure. We could hit herd immunity by April, and then in that time we would only lose, and I say only. But we would only lose 80,000 people to the virus, and we would have herd immunity by April if we could amp that up. And then if you go through the tool and you go a little bit further down, we talk about social distancing and the measures that we've been taking to protect from the virus outside of the vaccine. And this is the one we see a lot of controversy about, especially with people going and protesting at the governor's mansion, things like that. This scenario is pretty scary. So if we ended restrictions now, we could reach herd immunity by May. But in that time, we would lose 320,000 lives, which is almost double the amount of lives. Like, we just surpassed the 500,000 mark. So we would have lost 800.
Hold on. So if we ended social distancing and masks and all that today,
and we vaccinated at the same pace we're vaccinating at now, we would hit herd immunity by May, but we would lose another 320,000 Americans.
Wow.
Which is almost what we lost in the last year, which we just hit that 500,000 mark. So that's pretty scary. But if we keep our restrictions in place and we continue to vaccinate at the pace that we're at, we're going to hit herd immunity by July, and we'll have lost 100,000 people. So social distancing works. These are mathematical models, but they definitely work. And our last model I wanted to show is around if the more contagious spread, the one we were talking about, the South African variant and the UK variant, becomes the dominant strains, we're going to see the scariest model that they have here on this New York Times article. And so remember, in King County alone, the UK variant, who has it, is doubling every 10 days. So it started out with one person, 10 days later, it was 2 people, so on and so forth. That math goes up really, really fast. So if we can still expect to reach herd immunity by July if we have this really viral strain, but we could double the amount of deaths. So if we don't continue social distancing and we just continue, or if we continue social distancing and we continue to vaccinate at the rate that we're at, but the UK variant and the South African variant become the dominant variant, we could lose 200,000 people by July.
That's wild.
It's absolutely wild. And if we, and it kind of goes up from there and gets scarier from there. So it's really scary. Like if we relax the precautions, which I think is that last tab there, we would hit our herd immunity by April with these new variants. But in this scenario, we would lose 530,000 people if these variants keep going. So I think this tool is super important. And it's something that I wanted to share because I wanted you to have this tool so that you could share it with people who maybe need a reminder of why social distancing is so important, why hand washing is so important, why masking is so important. It's because if these more viral strains take hold in our communities and we don't continue with the precautions that we know work, we're going to double the amount of deaths that we've already seen. So this is a tool for the skeptic. It's hard to argue with the math. Yeah. Although I do know some people who will.
do you ever have any good news?
We're going to get to the good news. The next story is our good news.
One second. Let me put these links in there in the comments real quick. So just put the UW in there. And now let me put this. This is from New York Times?
Yes, this is from the New York Times. And they've done so many amazing interactive articles this year, in the last year. They even did one using footage from the protests.
Yeah. They used our footage. The New York Times used our footage and went second by second in the pink umbrella footage and did an analysis.
They also did this one where you're basically writing like on the back of a coronavirus and you're like going through and it's showing how like masks work because of like the fibers. Mm-hmm. So it's like this little it feels like you're writing the virus through the mask and you're like, oh, I see why this works because you hit all these different threads and it's hard to navigate.
No, thank you. We won't be riding the virus today. All right. So it sounds like before we get out of here, you actually have an upbeat story.
I do have a little bit of a better story. So you guys might have heard of her. Her name is Lucia DeClark. She's 105 years old.
God bless her.
Yeah, lives in New Jersey and has survived the coronavirus. And when people asked her, well, what is your secret to such a vibrant and healthy life? She said that she eats 9 gin-soaked raisins every morning. So she puts them in the jar and she lets them soak for 9 days and then she eats them. So 9 days, 9 soaked gin raisins. I think it might be because, one, she was born in 1916 and she actually survived the Spanish flu. So she's a survivor of both the Spanish flu and the coronavirus now. But she also got the coronavirus 2 weeks after she got her final vaccine. And so she had a pretty mild case. Even with somebody who is 105 years old, the vaccine saved her life. So that is my feel-good story. And so I have a picture here of her and her family who came together to celebrate her 105th birthday. This was her 104th birthday. So it was last year, right before the coronavirus hit. So it looks like she's got a pretty happy family. And her family said she has a lot of interesting herbal remedies that she uses.
Interesting herbal remedies. Huh?
Like she's still...
some of that grandpa.
The one I really liked was that she brushes her teeth with plain baking soda, and she got her first cavity at 99 years old. So she has all her teeth at 105 years old. Wow. And has had 1 cavity in her life. I'm like, I need to learn from this lady. I'm just going to go use all of her herbal remedies.
Wow. All right. Well, yeah, the herbal remedies, huh?
Yeah, Jake's herbal remedies.
You know, that always has a different connotation in Seattle. You know, when you say herbal remedies. All right, man. Well, we're gonna get out of here. Appreciate you, Nikki. I'm savoring the flavor of you being here in the studio. We don't know the next time we'll see you here, but it was a pleasure to have you here today.
I'm happy to be here. I miss the team. It gets lonely at home. It's lonely out there, just me and the cat and the roomies. We're hunkered down, so it feels good to be in here.
Good stuff. All right, we're going to get out of here. You can catch us again tomorrow, together apart, tomorrow at 11 a.m. on the Coronavirus Update Show. Until then.